teams, Lauren and Rebecca here with Bizrok. In this week's video, we're going to talk to you about the post-op process. Now, hopefully you watched our last week's video on pre-op, but today's really about the post-op process because there's a lot that goes into it and a lot of things that are sometimes forgotten, right?
Yes, absolutely. So for your post-op, you want to make sure, one, that the instructions for post-op are actually given to the patient during the pre-op. So go ahead and review all those during pre-op, but then post-op, you want to speak to the ride. Make sure the ride doesn't have any questions and give them the same list of instructions. You think that you know what's going on that day and you will tell your provider that you're fine, you understand, but the patient really, they do not, and they won't remember the day if they're fully sedated. So making sure that their caretaker has a list of post-op. The next thing is if a patient needs to use the restroom before leaving or upon leaving, if they tell you they can walk and they have not been heavily sedated, they're able to with an arm-to-arm escort. Please do not stand in front of your patient. You arm to arm and then keep one hand on their back. So that way, if they were to fall backwards, lose their balance, you are there to help guide them down to the floor. I would suggest though, all sedations 100% needs to be wheelchaired out, especially if they're heavily sedated. It just protects you and their patient. We think we can handle their body weight, but when a patient actually passes out or they lose their foot, they get very heavy. So you think you can handle 200 pounds, but that is a lot of weight for you to handle when they're going down really fast.
Well, and it's just not worth the liability. It's not worth the liability for the practice, but also for the patient's safety. So I'm glad that you're bringing this up because we've been in those practices. The patient's heavily sedated, we're waking them up and we're starting to escort them out and we're just walking them out, which I'm always fascinated by. I'm like, it's so easy to just place them in a wheelchair, like let them kind of get their bearings because they were just laying down, right?
Right.
So I'm glad that we're having this conversation because it's so important.
It is important. Upon wheeling them out to their vehicle, I always want to tell my teams to make sure that they are the ones to open the door and actually place the patient in the car and buckle them up. Yes. Do not allow the ride to say, it's okay, I've got it, because that's not what they do. They just want to be helpful and they want to help in the situation. But legally, we need to buckle our patients up. That way we can put in our notes that we buckled them up and did not place that on somebody else liability-wise. So once you have them buckled, make sure that it is secure, take a pull on it, and then the patient's able to leave.
Yes.
But that needs to be notated that you buckled them. We don't know where they're going after the appointment. So if the patient were to stop at CVS or Walgreens or somewhere to get medication and they get out of the vehicle with their ride, we know that they were buckled when they left our office. So that at that point, the liability is off of us. Hopefully they get buckled back in and make it safe home. But we just want to make sure that we are taking all precautions and we are notating that the patient's in the car safely.
One of the things too, because you mentioned it briefly, sometimes the person driving them, their ride will say, oh, I've got it. So it is okay to educate them and just say, hey, thank you so much for offering. Legally, I do have to buckle our patient into the ride. I know that you've got great care of them, but legally this is my job and I have to do this so that we can notate that we personally buckled them into your vehicle.
Yes.
So in fact, I would use that verbiage so that it's not some sort of awkward exchange because then the ride might be like, why are they so insistent on buckling them into the car? And they need to understand it's a safety thing, but it protects the practice.
It does. And also to me, it gave me a peace of mind. I knew that my patient was safely buckled in and making it to their home. And then when I was able to call for a post-op, I would verbally, of course, make sure everything was okay. But just making sure that you have them buckled. If I can give you one thing to take away from this video, it's to buckle your patient up. That is so important, and use the wheelchair. We have it, utilize it. There's no reason not to.
Yes. And then last thing, Rebecca, can we kind of revisit the restroom situation? Because I know it's awkward and I know nobody wants to talk about it. But guys, whenever you sign up in your practice to provide different surgical procedures and putting your patients under, there's a different set of expectations and a liability that goes with it. And again, I know nobody likes this conversation, but we have this when we're doing team optimization and team operations training. So can you walk us through that process?
Yes. So if a patient is sedated and they need to go to the restroom, you will place them in the wheelchair, even if it's not heavy sedation and it's light sedation, because it's quick. So you're not giving them time to get their bearings, because normally when they tell you they need to go right then. So you transfer a patient into the wheelchair, take them to the restroom. If their ride is there, the person that's going to be taking care of them that day, they can go in the restroom with them to help them. If not, we may need to, as team members, step in and help. If it is a male patient and we have a male doctor in the office, I would always suggest going and getting that doctor and letting him go in. If it's a female, you you can have another female escort the patient in. Once they get into the restroom, if they are able to stand, you can shut the door if it's not heavy sedation, but you cannot lock it and you have to stand right there. In case you hear something, you're able to go in and assist the patient.
Yes. So, and obviously just communicate that to the patient. Just, I am going to ask that you don't lock this door. I'm right here if something happens or if you need anything.
Yes,
so
absolutely.
that way they have that expectation.
And they know what's going on that way.
Yeah, and guys, we're in the medical space, right? We happen to work on the mouth, but at the end of the day, we're medical providers. And so we have to act like that, right? And we have to take care of our patients to the best of our ability. So if you need any additional support or guidance or resources, please reach out to us. And guys, please refer back to your team optimization guide, because a lot of the things that we talk about, we provide these consents and these templates for your practice as a guide, as a starting point. So reach out to us if you have any other questions. Otherwise, we can't wait to see you and serve you soon.